My name is Maxine Mackintosh. I'm a data science PhD student at the Farr Institute of Health Informatics, and I'm also the co-founder and chair of an organisation called Health Tech Women, which looks to support and promote more women to get involved in health innovation. Being nominated for the Women of the Year IT Award is obviously an absolutely enormous privilege, but also quite a surprise. I don't really feel like I work a day in my life. I wake up every day quite literally and want to transform healthcare using technology. So it doesn't feel burdensome, it doesn't feel like I'm doing anything grand. So it feels very nice that people recognise it, that I'm impacting people's lives and that people want to celebrate some of the things I've done. So it feels hugely overwhelming and a huge honour, and really nice to be able to share this with lots of people at the event as well. So Health Tech Women UK was started about a year ago, and it's because I spent a few months out in the Silicon Valley just to experience that environment, get the inspiration. And when I was out there, I met a bunch of women who had set up Health Tech Women out in San Francisco about 4 years ago. And I thought the idea and the group of people they got together was really quite impressive and had set a very different kind of tone in digital health than most of the other events I'd been to. So I thought, let's set this up in London, let's set this equivalent up in the UK. So in November last year, I met my fantastic co-founder, Louise Sinclair, and together we set up Health Tech Women UK. So we started in London, and since then have launched to 6 other hubs in the UK. We're now 10,000 members strong in only a year. And we do everything from putting on local meetup events to speaker brokering for local schools to international conferences. We help with job finding and recruiters. We look to bring together interdisciplinary groups for round tables. And we do everything from policy work to design work to techie work. It's really hitting that whole spectrum of the health tech sphere. A big thing for us is also just to get people who currently aren't involved in health technology into the sector. So that's clinicians struggling to set up their new job, that's academics struggling to move into industry, or techies looking to move into health or health into tech. Just those sort of transition groups that currently feel a little bit excluded, I guess, from the main health IT discussion. What we're trying to really achieve is just general better representation in healthcare. Something that we feel quite deeply about at Health Tech Women is the fact that we are at this inflection point in healthcare. And if we're going to design an effective and representative healthcare system, we've got to get an accurate and representative group of people around the table designing that. So there's been a big discussion around biases that can be built into systems unless we address them early. And given the whole focus on tech now in the future of most sectors, I think we're at risk of really exacerbating those biases and widening health inequalities, really. I think what makes me most proud about Health Tech Women is the fact that to harness lots of people, create a community that really works very well together, that's very vibrant, that genuinely brings people together in a way that gets the best out of a large group of people, can be very difficult. I mean, everyone is looking to create communities and create networks, but if you strike the right tone, then you can actually get the best out of people and really effectively harness lots of people doing amazing things. I think what I'm really proud about the fact is that whatever we've done, and it's not been structured and it's not been targeted, but whatever we've done, we've clearly struck a chord, and we've brought in lots of people who currently weren't involved in health IT or health technology. We brought in clinicians who were struggling to set up their health technology companies. We brought in academics looking to move into industry. So we really tapped into that under-harnessed intellectual capital, I guess, and brought in people who were otherwise apprehensive to get involved in health innovation. So I think probably what I'm most proud of is the fact that we've really brought in these novices and brought in these people who weren't currently accessing the field, and given them a platform to really flourish. BCS has been unbelievably supportive from day one with Health Tech Women. I think that IT in general obviously has a gender problem. I don't think that anyone is unaware of that. I think it has a general diversity problem. I think women is just one aspect of that intersectionality discussion. So BCS has been very keen from the get-go to support what we're doing, and also to feed that back into the organisation. And Andy Kinnear has been absolutely fantastic in both bringing this far up BCS's agenda, but also spreading that general kind of people-powered love. I think that Andy has been fantastic in generating genuine passion from crowds, and very much is in line with the Health Tech Women ethos as well. I think the advice I'd give to someone starting out in a career in data science, informatics, in health, is that it's quite a new field. So data science didn't really exist 10 years ago. Informatics itself is a combination of statistics and computer science and that sector domain speciality, in this case healthcare. And I think that it can be difficult to work out where your niche is. Are you a statistician? Are you a computer scientist? Are you a clinician? And I think that one thing that I would encourage people to realise is that everyone has their place, and it's about how you work effectively within that team to run your analyses or to do that bit of research or to work effectively within an organisation. So I think that the nature of informatics is it's very interdisciplinary, and so understanding both sides of that quantitative and qualitative barrier, as well as where you sit within that interdisciplinary space, I think is probably a hard thing to understand, but it's okay as well. So interestingly, health IT and health technology has the same representation than just the general tech world, which we've always found was quite surprising in health tech women. So the NHS itself is 77% female. Yet when you look in the health IT sector, for example, only 9% of medtech companies are founded by women. So there's absolutely enormous disparity. And you can see the same in leadership as well. Only a third of medical directors are women, for example. So you still have that pyramid of leadership, as well as that problem in attracting the higher risk jobs, like being a founder of an organisation. I think in order to allow women and facilitate the empowerment of women or general underrepresented groups in health IT, I think it's providing a bit of a space for them. I think that it has been quite difficult with health tech women to articulate the need for our existence, given the fact there are so many women in healthcare. But a good example is Innovate UK. They really struggled to get enough female applicants to their grants. Yet when they did a call for just women, they actually had to get more judges in, extend the deadline, because they were overwhelmed with the number of applicants. So that's, I think, a really good example of how providing a focus space for underrepresented groups can be hugely beneficial. I think it's, again, about creating that bottom-up community and support network that's not generated by some organisation that's got an incentive, but it actually just strikes that chord in quite a personal human way. I think that's the best way to get women to feel empowered is to build those networks of collaborations and support. And I also think a big thing is role models. Getting more women up on stage speaking at conferences, in interviews, on the news, providing evidence, just in those leadership positions. I think that's hugely important to attract more women into this field. IT historically has been very much a man's world, but health IT should be one of the leading sectors in actually having a much better gender balance, given the fact that it's quite so imbalanced from the female perspective in traditional healthcare.